Hi, my name is Mark Simon, and I'm an emergency physician at FMH. I'd like to start today with a video that was created by emergency physicians from across the country.
What's up, America? This is Jack Story. I'm an ER doctor in San Diego.
Jessica Mason here, emergency medicine physician.
My name's Anand Swaminathan.
My name is Jessie Davis.
Dr. Alexandra Ubija.
And I want to really plead with you guys to stay home.
Please stay home.
You need to stay home.
Don't come to the hospital unless you're really sick.
Help the healthcare system cope with the outbreak.
Because this is not about just one city or one state or even one country. This is about all of us.
And I'm taking care of younger and younger patients who are getting this, who are needing mechanical ventilation, and it's scary. It is scary out there. We want you to stay home and stay safe.
Please stay home right now, because even if you are feeling fine, you might have coronavirus and spread it to someone who won't be fine and could get very sick and die.
You can get my team sick, which means that we can't take care of you when you're most gonna need it. We can't take care of your loved ones when they're most gonna need it.
We're working really hard for you right now, and we want you to stay home for us.
Stay home for us so that we can go to work for you, I think is the motto.
We stay here for you. Stay home for us.
We stay here for you.
You stay home for us.
We stay here for you. You stay home for us.
Before I move on with the rest of my comments, I'd like to ask that we take a moment to honor those in New York City and other locations across the country and around the world that are now in the most intense phase of managing COVID-19 in their community. Thank you. Today, I'm thankful to report that there is no crisis within our emergency room at FMH. I'm thankful to report that we are not putting younger and younger patients on the ventilator, as my colleague from Brooklyn, Dr. Swaminathan, described in the video. I'm thankful to report that our local healthcare resources are not yet overrun with critically ill patients. To be clear, that is not because we are better than anyone else. And that is not because we are somehow immune by virtue of being Alaskans. We very much remain at risk for all these tragic consequences. The reason Governor Dunleavy, Alaska's Chief Medical Officer, Dr. Ann Zink, and all your local healthcare leaders have been stressing the message of stay home, stressing the practice of social distancing, stressing hand and face hygiene, and use of a homemade mask is because those are the only things that separate where we are today from becoming where New York City is today. The only thing that will prevent our community from experiencing the same tragedy is action by you. The only thing that will prevent me, as an emergency physician, from having the same experiences as Dr. Swaminathan is action by you. I want to take a minute to talk about the valuable work, the critical and often underappreciated work that public health agents do. And I want you to consider your role as a public health agent. Public health, by its nature, is about prevention. And prevention, by its nature, is subtle. The tricky thing about preventive care is that you might not know who benefits. Who, by virtue of wearing a helmet, didn't die when they crashed their motorcycle or bicycle. Who, by virtue of getting a vaccine, didn't die from an infection. And who, by virtue of changing their diet and exercising, didn't become disabled by a heart attack or stroke. Most times we can't answer these questions, but please don't let that lack of clarity make you think preventive care is any less important. And where COVID-19 is concerned, prevention is even more critical. The antidote for COVID-19 is not treatment, it's prevention. And the best preventive tool we have for COVID-19 is to limit its spread. I can't tell you whose life you will save by staying home and sheltering in place. I can't tell you whose life you will save by practicing strict social distancing, a minimum of 6 feet apart. I can't tell you whose life you will save by practicing good hand and face hygiene. And I can't tell you whose life you will save by wearing a homemade mask when out in public. I can only tell you that if you do all of these things, you will save lives. I'm fortunate to be in a profession that provides me with the opportunity to help people every day. And at times, I'm able to be part of a team effort that saves lives. You all now have that same opportunity to be part of a team effort that saves lives. The life you save may be your own, it may be a member of your family, or it may be the life of someone you never have the privilege of meeting. Regardless, I hope you recognize the power you have to save lives. I hope you recognize this opportunity, and I hope you take advantage of it. In this moment, at this time, we need everyone to be the best public health agent they can be. Stay home, shelter in place, practice social distancing, a minimum of 6 feet apart, practice hand and face hygiene, and please, if you have to leave the house, wear a homemade mask. Thank you.